Alrighty, so this is Brent Smith doing his psychomotor practicum assessment. First, I'm going to put on my gloves. Then we're going to go ahead and size up the scene. This is not a dangerous scene at the moment. There is only one patient, and she is laying on her back. Uh, so there might be possible spinal injury. Don't know yet. I'm not going to ask for extra assistance quite yet, but I'm going to leave that as an open option. And I'll walk up to her and ask her, "Ma'am, what's wrong? Did you hurt your back?" No? Okay, so spinal injury is mainly ruled out. Um, my name is Brent, and I'm here to help. What's wrong? Um, you're having the worst menstrual cramps of your life? Okay. So from the response, I know that she is aware of her surroundings, so she and responsive to vocal stimuli. Her airway is open because she was able to respond. Her breathing is fine, or else she wouldn't be able to talk. I'm going to go ahead and, man, is it okay if I help? All right. I'm going to check her pulse just a quick second, make sure she has one. Looking over, make sure her skin looks fine. It's a little flushed, but I wouldn't say anything that was out of the ordinary. Um, then I'm going to go ahead and make sure that there is no crazy bleeding, ma'am. Is there any bleeding? No, nothing yet. Oh, nothing at all? Okay. So I'm going to go ahead and ask her, when did this start? Uh, it started 30 minutes ago? All right. Um, so what is the pain here? What kind of pain? Is it a sharp, dull? It's extreme cramping? Alrighty, ma'am. On a scale of 1 to 10, how bad are these cramps if 10 is the worst pain you've ever felt in your life? A 10. Wow, okay. So what started the pain? What caused all this pain? You were swimming and it just started to come on? All right, ma'am. Has the pain been a constant pain? No, it's been on and off? Okay. Ma'am, how old are you? 31? Okay. Um, and what was the last thing you had to eat or drink? You had you had a grilled cheese sandwich with pickles in it. Okay. And what did you have to drink? You had cream soda. Okay. Well, then we have, ma'am, are you sexually active? Yes. Okay. Are you on any forms of birth control? Yes. What kind? An IUD? Okay. What form? The copper? All right. And how long has that been in there? Since you were 19? So you're 31, that's been in there 12 years. Okay. Um, do you have any medical history of any sort of bad cramps? No? All right. Does anyone in your family have that? No? Okay. Are you taking any medications that would cause something like this, or any crazy medications? No? All right. Ma'am, I'm sorry to say this, but you may be pregnant, and I'm going to go ahead and check your vitals and everything. And if the baby starts to come, I am prepared. All right, so we'll start with her blood pressure. So we'll get a cuff and put it around her upper arm, excuse me, and then measure on right there in the crease of her elbow with a stethoscope. The pressures where we can hear the first noise of the heartbeat coming through the artery, and the second noise. And hers comes out to be 150 over 90, so that's fairly high. We'll go ahead and check her pulse, and it comes out to be check her pulse by checking the radial pulse. Um, and it comes out to be 110 beats per minute. And then we'll go ahead and listen with the stethoscope for her breathing, and that comes out to be 30 beats per minute, or breaths per minute, excuse me. And they're very shallow breaths. Alrighty. And at this point, I would go ahead and call another EMS just in case if we were not able to transport her or did not have sufficient materials, but we should. Uh, it, in the event that the baby was starting to crown at any moment, we would have some sheets laid down. ready to go. Her knees would be bent 90 degrees and her legs would bow out so that it's easier to pull out the baby. So in the event that the baby is coming out, we would have the head start to poke out. We would then push down for the first shoulder to come out and push up for the second one, assuming that there are no, the umbilical cord is not wrapped around the neck or anything damaging. And the umbilical cord would come out. We would go ahead and clip off roughly 2 centimeters away from the baby, and then another 4 centimeters away from that, and cut in the middle of that. So we would have the baby all fine. We would leave the umbilical cord sticking out of the mother. We would clean the baby off. Go ahead and make sure that he's breathing. If he's not immediately breathing, flick his feet and see if there is a response, and do our best to make sure the baby's okay. Clean him off. Alrighty. And then try to put some clothes on him before anything else happens. So go ahead and wrap him up. We'll wrap up our Coca-Cola can baby in a koozie and cover the baby's head. And then we will hold the baby with his feet higher than his head. And then I'll pass him off to my partner. And then we would want to wait for the amniotic sac to be delivered. That can take up to 30 minutes, but if it does take longer, do not pull that out. And as that would be coming out, it would be... all right. And then with this, we'd want to go ahead and make sure that there is no discoloration, and in this one, there's not. Then we'd go ahead and pack up the amniotic sac and what was left of the umbilical cord, and either in some sort of box or bag container, and then we would transport the baby and the mother to the hospital. And if additional EMSs are arriving, we would say it's a 31-year-old woman, we would then go ahead and recheck her vitals and the baby's. Her vitals would come out to be something in the range of a blood pressure rate of 100 over 70, with a pulse of 70 beats per minute and a respiratory rate of 21 breaths per minute. And then we would check the baby's, and his would come out somewhere around probably above 75 over 50 for the blood pressure. The pulses would be over 100 per minute, or in the neighborhood of 100 per minute, and respiratory rate, would be 40 breaths per minute. And then we would, if a additional EMS was to arrive, we would go ahead and say that we had a 31-year-old woman who was pregnant, and we delivered. Did I just mute myself? Did not mute myself. Okay. We had a 31-year-old woman who was unknowingly pregnant. We delivered the baby and the amniotic sac with no complications. The baby's blood pressure is 75 over 50 with pulse of 100 beats per minute and respiratory rate of 40 breaths per minute. And the mother is 100 over 70 for a blood pressure, 70 for a pulse in beats per minute, and then we'd have 21-ish breaths per minute. Alrighty.